Hi, welcome. I see that you're here for an ear exam. Yeah? And can I just check that you're the correct patient? Can you give me your full name, please? Amazing. And can I also have your date of birth? Great. And please, your postcode as well. Thank you. And your address with it. Yeah, thanks. Amazing. Yep. So I see that everything is right. You're meant to be here, which is great. So it says that you're here for an ear exam. Could we try to... Well, can you help me figure out what's going on? So have you been having any pain or loss of hearing, or what seems to be the issue? Okay. Oh, okay. Yeah. And is this pain acute? Is it like sharp, or is something more dull? Like, does it feel like it's all over the ear, or is it just in a specific area? Is it inside of the ear? Yep. And would you say this is sharp, or are you feeling like more of a pressure type of pain? Yep. Okay. And have you been feeling any sensitivity around the ear or in the ear? Are you experiencing any headaches? Okay. Have you heard any ringing? Yeah. Any specific times? I'm sorry about the noise, by the way. It's very busy today. But great. Good. So, sorry, did you tell me how long this has been going on for? Okay. Sorry. Yeah. Good. Okay, perfect. Okay, perfect. So if you just sit back and relax for a second, I'm gonna examine. Is it both of your ears or just the one? Both? Okay. I need to put on my gloves, but just sit down for a second, and this should not cause you any discomfort. So if you're feeling any discomfort, just let me know. So I have my otoscope here, and it's got a very gentle light with a magnifying glass. And I'm just gonna have a little look inside of both of your ears, okay? So I'm gonna get quite close to you, and I want you to just stay still. Okay. And I'm gonna look at the other one as well. see that it's a little bit sensitive. It's a little bit red inside of the ear, and it's also, I think we could do with a bit of a cleaning. It's not too bad really, but I just want to get everything clean so it can heal. I think you're just suffering with some irritation, but we can clean that. We can make sure that everything goes away, and then everything should be fine, so don't worry. So, have you cleaned your ears recently? That's good. Yeah, that is perfectly fine. It is quite normal for wax to build up, especially if we use the Q-tips. I don't know if you use those, but I'm also gonna have a little look on the surrounding of the ear. I was more worried about the inside because of the symptoms you've been mentioning, but I will have a look at the exterior as well, so we can kind of tackle this. Let me just put this on for a second. Let me see. It looks like you seem to have irritation overall. It's more strong in the ear, but I'm thinking maybe you've been using something new in your routines. Okay. That's alright. Perfect. So first I'm gonna do a little bit of a cleaning. I'm gonna spray a little bit of cleaning solution. And then on the other one. And a little bit of cleansing soap as well. And just mixing it up. On the skin. That is great. And now with some cotton, I am just gonna remove that. So, if I have a look again, it is starting to look, yeah, Good, so I can see that it is a little bit more red now. That is fine. It's just because I am manipulating here. It lets me know that it's sensitivity for sure. So I'm gonna use this Q-tip not to clean inside, no, I'm just gonna use it to clean outside. Great, thank you. Very good. I'm just gonna spray a little bit of sterile solution. And I'm gonna just massage it. That is great. Now I'm gonna move on to the inside of the ear, if you don't mind. I have a few tools here, and do not worry at all about how sharp they are, some of them. It's just to make sure I get everything out. Then I'm gonna do a little bit of a clean, and then after that we are gonna have just a small hearing test, and we'll see if this has been a bit better. Perfect. So before we start, I'm just gonna ask you to tell me when the ringing stops, and then we can compare it. Okay? So. Okay, again, please. Okay, now the other side. Sorry. Amazing. amazing. Good, so that is not too bad, but I can see what you mean. I am just gonna grab a light and I am gonna start by going in and having a little clean, okay? That's good. I'm just gonna go on the other side now. Sensitivity or pain. left one is looking better. Let's have a okay. That is good. I'm gonna apply some of the saline. So you're gonna feel a little shot. It's not a shot, but it's just a little shot of water. Just gonna massage it. Okay, so that is looking good. Now I'm just going to do a very short hearing test, okay? We're going to start again with this, and you're going to let me know when it stops ringing, okay? Good, and again on the other side. Good. Okay, so that was perfect. Now I'm gonna take this off, and so I have this little contraption here, and I'm gonna place it on your ear, and then after that I will speak through this, and if you can, could you please repeat what I'm saying so I can see that you can hear properly, okay? I'm just gonna place it there. Apple, apple. Yellow, yellow. Perfect. Red, Good. Poke, poke, poke. Amazing. I really like this sound. That was great. Now I'm just going to test your sensitivity, and you can tell me if I'm using this or this sharp object so in your ear, so you won't be able to see it, but you can just tell me if you can feel it. How was that? Yeah, that was sharp. Good, that was dull. And now on the other one. Yeah, that was a sharp one. And then that was a dull one. What about now? Yeah, and then on the other one. Again and again on the other one. That was the sharp one, and again. Again, and now the other one. That was the sharp one, and again. Again, that was the dull one. Well done. I think that's everything. I have applied a solution on your ears, and I would like you to take that. So I will make you a prescription that you can take with your pharmacist, and you can use that. You can use that every day at night and use it for 2 weeks, okay? And then if the irritation has not gone down, call me back. But if the irritation has gone down, then you can use it 2 times a week for a month, okay? And then you can call me. Alright, perfect. That is amazing. I'm gonna write as well some recommendations. So no Q-tips. Okay, do not apply anything other than the cream that I'm prescribing to you, please, because with the moisture sometimes it can cause more irritation because it harvests the bacteria in there, so you just want to be careful with that. Okay, and after you shower, just dry your ears very well, in and out, but don't use Q-tips inside of the ear. Okay, amazing. That's everything. I'm just gonna make a little note here that I will see you in a month and a half if everything goes fine. And if you have any other problems, just call. Okay, and I will help you out. And if you need to come and see me as well, come and see me. Don't worry about that. Thank you so much. Okay, I'll see you next time. Thank you. Bye.